Dr. Huang has been the Director and Health Authority for Dallas County Health and Human Services Department since February 2019. Before being the Director for Dallas County, he also served as a Medical Director and Health Authority for the Austin Public Health Department for 11 years. He received his undergraduate degree in civil engineering from Rice University, his MD from the University of Texas Southwestern Medical School, and his master's in public health from Harvard with a concentration in health policy and management. While at Harvard, he led the successful movement to rid the school of their tobacco stocks. Dr. Huang has also completed his residency training in family medicine at Breckenridge Hospital in Austin and was chief resident during his final year. He served 2 years as an epidemic intelligence officer with the Center for Disease Control and Prevention, where he was assigned to the Illinois Department of Public Health, where he conducted studies in chronic diseases and infectious disease outbreaks. Currently, he is an assistant professor with the University of Texas at Austin, Dell Medical School, and assistant professor with the University of Texas School in Public Health in Austin. Dr. Huang, thank you so much for being here with us today. To get started, I do have a few questions to ask you. As I said earlier, we're trying to make the connection between vaping and COVID-19 and what the two have an impact on each other. So to start off, what is the connection between vaping and COVID-19?
Sure. Well, there have been studies looking at the connection. Some of the things, it's obviously a not good, it's a risk factor for developing COVID-19. I think some of the studies looking at teenagers, young adults who vaped, had a much higher risk of developing COVID-19. I think it was even 5 times higher risk of testing positive among those that got tested. So definitely, and also that association with more severe complications, as with smoking conventional cigarettes. So, it's in general, it's not a good idea to begin with. This is one more reason not to vape or to use tobacco products.
Definitely. I definitely agree with that, especially seeing as both of them attack the respiratory system. I also do have another question for you. How did the
Sure.
tobacco industry, I know you were talking about at Harvard, you helped get rid of the tobacco stocks. How did you go about doing that? So I know we're all advocates here in the presentation. We want to learn how to be better advocates. So how did you go about getting rid of those tobacco stocks?
Sure. Well, let me first say one thing, and it's really an honor to be here with you all, because before I was with the Austin Health Department, I was actually over chronic disease at the State Health Department for many years, and that was during the time when we sued the tobacco industry, the big tobacco settlement. $23 billion to the state of Texas at the time was the single biggest legal settlement in legal history. And this is when we birthed the whole youth your summit. We did the very first summits years ago. I used to go to every one, and they were a great. Yeah, I mean, it's so great to see that you all have kept these up and the impact that you all are making. So it's a real honor to be here because yeah, I go back a long time with you all on this effort, and some of the people I know that have been Jennifer, obviously, but and I think Ruby still works with you. I mean, Ruby was a one of our first youth ambassadors. I think she still works with you. But anyway, so you were asking about the Harvard divestment. Yeah, that was while I was getting my MPH. Tobacco had been a big issue I dealt with also during medical school. I worked and joined, I created a chapter of this group called Doctors Ought to Care, or DOC, which was really devoted to exposing the methods of the tobacco industry at, just the despicable things they do and how they, deceive and everything. And so when I got to Harvard, really wanted to do some activity regarding that. It became apparent, and I didn't know it until I got there. Harvard was like one of the largest institutional investors in tobacco, as at the time was Rice, where I went to my undergraduate. And that still may be an issue because we've been trying to work on them over the years. But so while I was at Harvard, one of the courses I took was working with the media. And the person who taught it was actually this media. He was I mean, internationally recognized media sort of guru out of New York City. He had done some of the most famous political campaigns. It's before your time, but there was this famous political campaign of Lyndon Johnson versus Barry Goldwater, and there's this little girl picking daisy petals, and then there's this nuclear explosion because there was a threat of nuclear war at that time, and so it was really. But he taught our course in use of media, and so I made a radio ad during that course where I took an excerpt from the president of Harvard, one of the speeches he had made about how important it was for universities to demonstrate strong social and moral values. And then I had the announcer, play this excerpt from the president, and then the announcer comes on, President Bach is Harvard demonstrating strong moral and civic values when it continues to invest in the tobacco industry, and talked about, how it kills, more than AIDS, crack, heroin, cocaine, alcohol, car accidents, fire, murder, and suicide combined. And we made that radio ad, and so it was professionally produced, and actually sent the president a copy. And we said, and there was an anonymous donor out of New York City that said he'll start airing the thing if we need to. And so we sent it to the president of Harvard and said, if you don't do something about this, we're going to start airing this ad. And we got a letter back saying, hey, we've decided to sell our tobacco stocks. And then we publicized it and got them to actually make it a policy, because it wasn't just enough that they sold it at that time, but we wanted to make sure that they didn't sell it, buy it even in the future. So that's sort of where that went. But it was a great initiation or, experience just to be in that setting, to work on advocacy like you all were doing.
That is awesome, Dr. Huang. That's literally talking about airing out tobacco's dirty laundry. I do really want to mention, you were mentioning earlier that you've been working with Say What since the very first summit, and that's super awesome. I just give a really big kudos to you, Dr. Huang. I do have a few questions and comments in the chat, though, that I want to ask you really quick. I have a question from Andrea Littlefield, and she's wondering if you still play the trumpet.
I do still play the trumpet. Although actually, since I've been in Dallas, I haven't, and with COVID, I haven't played in a while. I mean, since it's been about a year, but we used to do every year a little Christmas brass choir. We play in the city hall at Austin. Used to play at the state health department every Christmas. And I actually, when I was in Austin, I was in there was a medical orchestra, but haven't done as much in Dallas, but a lot of my band friends, because I grew up in Dallas, are still around. So.
That is awesome. Thank you so much, Dr. Huang. Those are a few of the questions that I have for you. I still have a lot more questions, but I know Dakin has a question he wants to ask you, so I'm going to pass it over to him really quick.
Okay.
Good morning, Dr. Huang. So I did not know that you play the trumpet. I actually do play the trumpet, and maybe one day, whenever this pandemic's over, me and you can get together for a trio or something.
Sounds great.
I do have a question for you. So not everybody is interested in the public health field and all that. What got you interested in doing it?
So it's interesting. I mean, and I saw also something flash on there, what made me decide to go into medicine, because I was actually at Rice studying civil engineering. My father was a civil engineer. I got into Rice as an engineer, but halfway through, realized, I wanted to do something more with helping people. I think civil engineering and engineering is a great field, but I want to do something more directly with people. And so, thought about applying to medical school. I hadn't actually, it was my end of my sophomore year at Rice, and I hadn't taken a biology course, I think, since 9th grade. But, so I had to catch up a little bit on organic chemistry, some biology, but most of the engineering stuff was good for medical school. And so I did go to med school up here in Dallas at UT Southwestern, was interested in family medicine. But it was actually my last year of med school. I did an rotation, actually it was a medical expedition in international health in Nepal. and it was co-sponsored by Johns Hopkins School of Public Health. We actually trekked through the Himalayas, through the mountains, to get to this remote mountain village where we were, each of us along the way chose a public health topic. I chose infantile diarrhea and the use of oral rehydration therapy, to see if they had an infant in these remote mountain villages, what would they do? Would they restrict fluids, which would be bad, or would they give fluids, to rehydrate the kids? Along the way, this professor from Hopkins was part of the expedition, and he had articles for us to read, and we developed questions. Each of us provided a few questions to do on this survey that we administered to the villagers. We got to the village, we mapped out the village, did a random sample of households, administered our surveys. I found out, did key informant interviews with the local faith healers, found out that they would give the kids tea or something, some fluids if they did get diarrhea. I taught them then how to give a salt, sugar, water solution, how to make that. And so, I got really just interested initially in international public health. I got back to Southwestern after that and asked my infectious disease professor, well, what would I want to do if I want to do public health? And he said, well, you should think about this program at CDC called the Epidemic Intelligence Service. These are the disease detectives that go out, and CDC sends them out to investigate, outbreaks, things like that. So I'd already been accepted to and also the professor at Hopkins while on the trip in Nepal said, you should also think about getting a master's in public health. And I'd never thought about it before or really been exposed much to it. I went to my family medicine residency. I loved that. I loved primary care, but I also liked prevention and having impact on whole communities. So I kept all the things that professors had told me and kept in mind. So after I finished my residency, I went up to Boston and Harvard and did my master's in public health, and then also had kept in mind and applied to the CDC Epidemic Intelligence Service program and wound up getting into the outbreak investigations and epidemiology, and so that's how I got into public health. Yep. So.
Thank you. I also got one more question. So we know that you started off with the public health and stuff, but have you had an interaction or your family or whatever about tobacco, and did that kind of help you in your way to help them prevent tobacco, or how did that all start for you?
Yeah, a lot of it, and it turns out found out in Japan. My mother was Japanese, my father was from Taiwan. My grandfather in Japan actually worked for a tobacco company, and my mother used to say that he was very conscious, never smoked inside, was always conscious of that and knew about the health effects. And but then certainly growing up, there were people that I knew that, and some family members that died of tobacco-related illness. I think the biggest thing then during med school and during was working at the VA hospital. So much of what at that time the things that we dealt with were either tobacco-related illnesses and alcohol-related illnesses, and it seemed the prevention, it would seem so much better to try to prevent these things up front than have to deal with these end stage consequences, and all of those things together. And as I mentioned, the Doctors After Care group was really, I was motivated by them and started the chapter at UT Southwestern to, that gave me that awareness of how the tobacco industry, how they're making profit off of all this, and just, really motivated me to work on this. And plus, when you look at it from a population level, how tobacco is the biggest preventable cause of death and disease, and people don't know that. I mean, I still, in my talks, I give, say, what's the #1 cancer killer of American women, and everyone always say it's breast cancer or think it's breast cancer. They don't know it's lung cancer. And same for men. People don't know that lung cancer is the #1 cancer killer of American men. So that's how I got into it.
Well, thank you so much, Dr. Huang. There is another TA that does have a couple questions for you. Alex, if you want to go ahead and get back on and ask your questions to Dr. Huang.
Yes, sir. Thank you so much for that transition. Dr. Huang, it is a pleasure to be in your presence. So my question is going to be a little, it's a good question in my opinion. So my question is, what was the transition like from Rice to Harvard? And then what was it like transitioning from your engineering to public health?
Yeah, so I mean, right from Rice, I went then straight to med school. So that was getting back to Dallas. I mean, med school was difficult. It was, I mean, it's a lot of stuff to learn. But I think college prepares you well for that, and it's some different areas. And then going to Harvard, that was after I did my family medicine residency in Austin, actually. But Harvard, I loved the whole environment, the atmosphere. It was so exciting. You're there with people from all over the world, leaders from all over the world. I took a lot of courses also at the Kennedy School of Government. So learned, I mentioned the media course that I took, and these are from world experts. Again, that are teaching all these things, and so I loved that environment. And I loved Rice. Rice was a great place for anyone who's from Houston. Beautiful campus, great place to learn, great place to actually have a good undergraduate environment. So I've been very fortunate with all of those experiences. I think those transitions, they're all different. I think probably each one prepares you for the next, but and each of them had their own unique sort of great things about them.
Thank you, Dr. Huang. I have one more and then I'll pass it back to Janaea. My next question is, was there any moment in your years of schooling that you were like, well, I don't think I'm gonna be able to pull through? And if so, what did you do or what was your mindset when you were going through things like that?
Well, I probably, there were times in med school, I mean, there were both, there were a lot of academic challenges and then also physical challenges. I think they a lot of the stuff, memorizing all that stuff is hard, but you just do the best you can. You're with your fellow students that are going through the same stuff, and so having other people that we're all going through it together and sharing, and it's I think that everyone wants everyone to succeed, so make sure and take advantage of all the resources that are there, and if you are having any problems, let people know about it. So for me, I had a lot of other friends and support that were all going through the same thing, so we all just commiserated together and said how hard this was. I think physically, I mean, some of the call for med school or residency, you're on every third night. I think they reformed some of the hours and things since I went through, so it's not as bad. But I mean, we'd go 36 hours straight without any sleep, admitting patients to the hospital, things like that. So those things get hard, but I think the thing about it, and we talked to other people who've gone through it, I think the system is somewhat set that way so that then for the rest of your life, nothing is ever as hard as what you went through with that. So everything else is easy, but yeah, it's always, I think, probably the big things, just sharing it with your friends and other people who are going through the same thing.
Perfect. Oh, sorry. Perfect. Thank you so much, Dr. Huang. Janae is going to ask you a couple questions as well.
Sure.
Thank you, Dr. Huang. I did get some intel from up. Kathleen does have some questions that she wants to ask you as well, so I'm going to pass it over to Kathleen.
Well, Janae, if you want, go ahead and ask Jen's question, because it still fits with the topic of what Dr. Huang is talking about.
Jen, I do want to mention something really quick. I did have almost this exact same question typed out in my notes prepared to ask Dr. Huang, so I think it's amazing that you and I were thinking alike. So to read Jen's question, she asked, what advice do you have for youth who are pursuing a career in medicine or public health?
I tell people, and public health in general is such a great field. And, someone mentioned, that it seems to have a lot more popularity. you know, when I was going through, there weren't even public health undergraduate degrees. Now, you know, I know UT has it, Baylor, a lot of different, you know, A&M have undergraduate degree, and public health is such a great field. And what I encourage everyone, you know, at your stage, you know, find out what you're passionate about. You probably heard that, but what do you know, what excites you? What do you feel passionate about? Because that's the most important thing. And I have loved what I do in public health because you're able to, you know, make a difference. And I remember one of my professors at Harvard, the last day of class, was in health policy and management, and he gave this lecture, and he says, you know, you could be like selling cereal or something, you know, and that could be your job, and that's, you know, an admirable job. But in public health, you're really making a difference in the community. You're helping improve the health of the population, and you get paid for it, you know, and it's you know, it's something that's very meaningful. And I love the variety of things that you deal with public health every day. You know, I mean, we're in the middle of the whole COVID-19. I'm here out at Fair Park in Dallas. We've got our drive-through vaccination clinic here. I'll show you what we're dealing with here. But, you know, I mean, a year and a half ago, who'd have known we would deal with COVID-19? You know, we've dealt with Ebola, Zika, H1N1, you know, West Nile virus, all sorts, and tobacco, you know, obesity. All of these things are such big issues that impact so many people. And, you know, that you look at the importance of public health, COVID-19 has impacted our society like nothing else we've dealt with, certainly in my lifetime, the trillions of dollars that it's costing our economy. And it just shows how important public health is. And, you know, to be able to try to make an impact on that is huge. And I have always loved what I do. I love coming into work because it's always something different. I could be doing one thing and do the same thing every single day, but I love public health because, you know, you really get a lot of variety in what you're doing, and you make a difference in the world.
Okay, so I'm going to ask my question, Dr. Huang. It's kind of two parts, but given your extensive experience, expertise in the field of public health, but also epidemiology, what concerns you the most about this particular pandemic that we're going through? What concerns you the most about this issue of vaping and the youth vaping epidemic?
Sure. Okay, well, with COVID-19, the pandemic, I mean, what concerns me, I mean, this shows how, again, big an impact something like this can have. I think before this, my biggest fear was, you know, like pandemic flu, and this is very similar to what we're seeing with that. The concern, you know, that people forget, that people start to, you know, let their guard down, that, you know, now we start opening up things maybe too quickly, that people forget about how masks and avoiding crowds and physical distancing make an impact. And that we, you know, and with the variants that are circulating around, you know, we could get another surge here, which would mean a lot more severe illness, a lot more death, a lot more cases. And those are things that we're trying to prevent. And that would be tragic. So, you know, it's sort of human nature. We all want to get back to normal as soon as we can. But we also just, you know, need to, like, wearing the mask isn't that big a thing to ask. And it's been shown now how effective it can be. You know, with vaping, what is very concerning, discouraging, we'd made a lot of progress on conventional combustible tobacco products, and youth rates were going way down. And then now vaping, you know, has sort of re-normalized the smoking behavior, and it leads, again, both to increases in vaping and increasing, you know, conventional combustible tobacco products. All of those are just really bad things. It's just this new way of repackaging it and trying to hook more kids and get more kids addicted to nicotine. So, you know, that's, it's really horrible don't want to see that. And so that's where I appreciate everything that you all are doing to address this, and appreciate that you recognize how this is so dangerous.
Thank you.
Dr. Wong, talking about how tobacco sales have been rising, and you talked about them falling, and now they're going back to normal rates. How has tobacco marketing changed since you were our age? For example, marketing and how they targeted specific groups of people.
Yeah, well, I mean, and it was probably a little before my age, but close. I mean, like, it's amazing. You see some of these historical TV shows, or like even, do you know the Flintstones? Have you all heard of Flintstones? Yeah. I mean, you look at some of those old, there were cartoon episodes where like they're advertising cigarette brands. You know, it was, and again, it was probably a little right before my time. You know, there was I mean, a lot of marketing on TV and things like that. You know, so those have been restricted in terms of how much it could be advertised. You know, on TV and radio. But the themes are still the same. And, you know, I mean, like, that's what you look at, and you see the way that vaping has been marketed, and, you know, that it's cool, it's sexy, it's, you know, I mean, all these things are the ways they tried to market tobacco products. And, you know, for women, that it's, you know, like Virginia Slims and liberation and all these things. You know, those are, it's a lot of the same type of themes that just get recirculated and that are being used in vaping. So
I definitely see where you're coming from, and seeing how tobacco has changed a little bit, but still stuck to the similar methods that they have used in the past to market towards us. Did you notice any differences, like say the community you grew up in versus a different community, maybe one that was higher class or lower class? Was there any differences between the advertising there?
well, definitely we've seen, you know, how the tobacco industry markets to African American population, Hispanic, you know, different segments, and again, it's very despicable how they do that. You know, the whole menthol is, you know, targeting to African Americans. You know, I always, and I think it was Alan Blum who first got me to ask, you know, so what color is menthol? You know, and I asked that in a talk or something. People always say green. Well, that's totally a product of marketing. You know, it's not green, but all these menthol products have green on it, and people think it's green. It's, you know, sort of really clear, or and it just shows the power of how they can get these imagery, get with advertising, and you know, to associate these cool things and things in these you know, targeted markets. I know that, like, what was it? Yeah, like, you know, they used to do the Cool Jazz Festival, and you know, all these different things that they do, and so the targeting is really bad.
Thank you so much for answering that question, Dr. Wong. I also know that you've been an advocate for quite some time now. I mean, your work at Harvard, I'm sure you were probably working at a lot younger age to help get us out of this epidemic, and we, you know, end the vaping or tobacco sales in general. What advice would you give to a young person that wants to get involved and use their voice to create a change?
Yeah, I mean, get involved at the local level. I saw earlier on some of the presentation, it still is crazy that Texas doesn't have a statewide smoke-free ordinance. I mean, this is, you know, and we've got the local ordinances, those are great. But we should have, there are areas outside of the, you know, larger communities and rural areas in Texas that still, and I used to, when I was in Austin, I would always hear people, you know, they'd say, I mean, and this is unprompted or anything, they'd say, I forget how good we have it here. And then they go to some small town in Texas and someone lights up indoors next to them, and you forget that that's still possible places, and it is still possible in places in Texas. So it's sort of unconscionable that we still have that. And so being an advocate, local laws, I think the flavorings are good future policies that you can make an impact on. Menthol bans in particular, because of the marketing of that product, in particular to persons of color. And the policymakers listen when youth are active and engaged. And this is, I will say, and probably people of my generation, we are so proud of everything y'all are doing. I mean, it's actually sort of makes me a little emotional, because I mean, it has been so great to see how your generation are doing things and being these powerful voices on this. And I mean, really proud of you all for what you're doing. I mean, it's great, and you're doing a lot better job than generations before you at it. So keep it up, but just be out there, be advocates, and let your voice be heard, and start at the local level, and keep in state and everywhere.
Thank you so much, Dr. Huang. I know we're all proud of how far we've come, especially with raising the tobacco sales age to 21 in Texas. That was a really big achievement for us. And then, of course, when President Trump signed it into law for the United States, that was awesome as well. When I was reading your bio, I saw you did so many things. You went to so many schools. You accomplished so many things. So I have to ask, what is your favorite accomplishment in your career so far?
I mean, I think there's a lot of things we've done. Probably the tobacco work that we did early on, working on the tobacco settlement, getting, a lot of the things, part of, the creation of the youth, program, that was all part of the tobacco settlement resolution. I mean, it's still, a lot of work to be done. We made progress. It takes a while. It's incremental. So because tobacco is the #1 preventable cause of death and disease, and to make some dent in that is certainly important. And so, yeah, I think that the work in that area is probably the biggest impact. But we've dealt with now these other things, COVID and everything, that our responses, and
That sounds really awesome, Dr. Huang. I want to thank you once again, as we're nearing the end of our time for our questions. Thank you so much for coming on here again. I know you're very busy and you have a lot of meetings to go to. I know earlier you had a meeting to go to. We're very grateful that you're here just to talk to us and share some of your knowledge and expertise with us. So thank you so much for being here, Dr. Huang. It was a pleasure having you.
Sure. Keep up the great work. Keep up these traditions. Yeah, take everything to the next level. Thank you all so much for everything you're doing.
Thank you, Dr. Huang. Have a good rest of your day.
Okay, you too. Take care.